Hello everyone. Are you scheduled for a CT or MRI scan soon? They're essential for getting an accurate diagnosis. But did you know that the contrast dye used in these scans can sometimes pose an unexpected risk? Recently, a young woman in Brazil tragically passed away from an allergic reaction to a CT contrast dye. However, this isn't just a story of tragedy. In this video, we'll give you the most crucial information and hopeful preventative measures to stop a similar tragedy from happening. In just 7 minutes, this video could be the key to saving your life and the lives of those you love. Don't look away for a second. On the 20th, a young woman in Santa Catarina, Brazil, faced a sudden tragedy while getting a CT scan for a kidney stone. Right after the scan, she went into anaphylactic shock, a severe allergic reaction. Despite receiving emergency care, she passed away less than a day later. The cause was the CT contrast dye. So what exactly is contrast dye? It's a substance injected into the body during imaging tests like CT or MRI to make certain tissues and blood vessels appear clearer. For CT scans, iodinated contrast dye is typically used. Think of it like a flash for your body, illuminating what needs to be seen. While contrast dye is very useful, it can be a deadly toxin for some people. This is because of anaphylactic shock. Anaphylaxis is a severe systemic allergic reaction that happens rapidly after exposure to an allergen. Your immune system overreacts, releasing a flood of inflammatory mediators like histamines. This can lead to widespread hives, angioedema swelling, constricted airways, causing difficulty breathing, and a sudden drop in blood pressure, leading to shock. According to one radiology specialist, contrast dye is highly safe and used in millions of exams worldwide, with serious side effects being extremely rare. In fact, the global incidence of contrast-related anaphylaxis is reported to be between just 0.04% and 0.13%. While it happens rarely, the fact that it can be life-threatening makes this a crucial message. Adverse reactions to contrast dye are a concern worldwide. According to major international health organizations and studies, thousands of adverse reactions are reported each year, ranging from mild rashes to life-threatening anaphylaxis. This has led to global medical societies revising their guidelines to recommend stronger patient risk assessments and improved emergency response protocols. These numbers are a warning sign we simply can't ignore. Contrast dye isn't the only trigger for anaphylaxis. It can also be caused by things we encounter every day. Common culprits include certain foods, insect venom, and specific medications. In some cases, symptoms can even appear from exercise alone, without any food consumption. Anaphylaxis can be lurking in our daily lives, triggered by a wide range of factors. So how can we prepare for this risk? Fortunately, there are clear ways to protect yourself. Avoid the trigger. This is the most important step. Know what you're allergic to and avoid it completely. Be cautious when dining out, avoid eating foods with unclear ingredients. Inform medical staff before any scan, especially a CT or MRI. You must tell your healthcare providers about any past allergies or adverse drug reactions. Know how to respond in an emergency. If you or someone around you shows symptoms of anaphylaxis, call emergency services immediately. If an epinephrine autoinjector is available, use it without delay. Today, we've taken a deep dive into the risks of anaphylaxis through the tragic case of the woman who died from a contrast dye allergy. Although rare, the potential for a fatal outcome means we must always be vigilant. But the most important takeaway from this tragedy is hope. We can prevent these events if we are prepared. Please remember the information we've shared today and pass it on to your loved ones. Your awareness could be the difference between life and death. Thank you for watching. If you found this video helpful, please give it a thumbs up and subscribe to our channel. Don't forget to hit that notification bell so you don't miss our next video. Your support means a lot to us.